Okay. Yes, hello, everyone. Our group is comparing the Verbal Behavior Milestones Assessment and Placement Program, or VB-MAPP, to the Assessment of Basic Language and Learning Skills Revised, or ABLLS-R, for the Assessment Comparison Analysis Project. My name is Bailey Flewelling.
My name is Wanjiku Kihanya.
I'm Iviana Maples.
Tahila Wax.
My name's Carly Wine.
So just a little overview of our presentation. We're going to be going over the demographics of our client. We're going to talk about the assessments by themselves, the VB-MAPP and the ABLLS-R. Then we're going to compare the two assessments and then discuss which assessment we chose for our client and why.
So to start off, we're going to start with the child demographic. Before or prior to choosing an assessment, we had a parent interview. The child is a 3-year-old female. Upon the parent interview, the child has minimal vocal verbal communication, engages in tantrum behavior, including falling to the floor, crying, and screaming. And this is with or without the accompaniment of aggression in the form of hitting or kicking. The client also engages in elopement behavior. The parent has desired outcomes to increase the functional communication of social skills and to engage in less tantrum behaviors as well as less elopement behaviors. So to continue on with this, after conducting the family interview, we have observed that the child shows limited vocal verbal communication as well as the child is able to make 1 to 2 word requests, but is inconsistent when responding. They're able to identify 10 out of the 20 preferred items. They show minimal developmental skills, including a lack in joint attention, as the client rarely exhibits joint attention and has no scanning skills, makes limited eye contact, and it can be spontaneous in imitating others, but is limited. We observed the client engage in imaginative play, but however, she has not been assessed for social play with peers.
All right, so the first assessment is called the VB-MAPP. It's actually an acronym which stands for Verbal Behavior Milestones Assessment and Placement Program. The assessment is broken down into 3 developmental areas: 0 to 18 months, 18 to 30 months, and then 30 to 48 months. And it covers 170 learning and language milestones. It lists 24 acquisition barriers and identifies 18 assessment areas for progress. So some of the skills that are assessed within the VB-MAPP are requests, labeling, play skills, and motor imitation. For barriers to skill acquisition, some examples of that that they cover are prompt dependency, failure to generalize, weak motivators, etc. And as far as the measurement type for the VB-MAPP, the testing is done directly. Then the data and scores are collected within the VB-MAPP protocol book, which also provides information on how to run the assessment and then also develop goals based off of the assessment itself. The reliability of the assessment with just reading the instructions is 57%, but then when you combine that with behavior skills training, or BST, it's increased to 92% accuracy.
I will be covering the ABLLS, or ABLL-R, also known as Assessment of Basic Language and Learning Skills. It is a tool in applied behavioral analysis that assesses and tracks the skills of individuals and developmental delays or disabilities. The ABLLS is designed for individuals from infancy to adulthood, focusing on a wide range of skills necessary for functioning and learning. This assessment covers a basic average of 544 skills across 25 different skill areas and is categorized into 7 domains. Those 7 domains are social skills, requesting, labeling, intraverbals, group and classroom skills, listener skills, and visual performance skills. Skills are assessed on a continuum from early foundational skills to more complex abilities. The ABLLS provides a structured way to identify strengths and weaknesses, enabling target intervention plannings. It includes both a curriculum version, ABLLS-R, and a scoring instructions and IEP development guide, ABLLS-3, offering flexibility and application. The assessment helps practitioners create individualized education programs and treatment plans tailored to the learner's specific needs. The ABLLS is widely used in educational and therapeutic settings to guide ABA therapy and monitor progress over time. The age range in which it is used is infancy to adulthood. Again, it has 25 skill areas with 7 domains. The measurement type is direct assessment. The data collection procedure is conducted through a protocol book, and the validity of this assessment has shown that this assessment comprehensively covers a wide range of skills needed for people with developmental delays or disabilities effectively. Also, in terms of the reliability, research has shown reliability. However, training and fidelity are needed to increase inter-rater reliability amongst raters.
Okay, so here we're gonna compare the 2 assessments, the VB-MAPP and the ABLLS assessment. So the VB-MAPP is good for ages 0 to 4, and the ABLLS is really great for all ages. The VB-MAPP assesses 212 skills. It's broken down into 3 categories: learning and language, acquisition barriers, and progress identification, like seeing how the child's holding. And the ABLLS assesses 544 skills, and it's broken down into 25 different categories. The VB-MAPP has direct testing. They see the pre-test score and the post-test score, while the ABLLS assessment is like a 0 to 4 scoring range. And the information is provided by the parents and the teachers. So 0 is the child can't do the skill, and 4 is they're able to do it very well. For the VB-MAPP, data is collected in the specific VB-MAPP protocol book. The book contains information on how to run the assessment, how to score it, and how to develop those goals. While the ABLLS, the data is collected in the ABLLS protocol book, and the guidebook includes how to run the assessment, score the assessment, and also develop how to increase and develop the goals. So those are pretty similar in that area. So for the VB-MAPP, the reliability, the reading is the instruction alone. There's 50% accuracy to implement it. And there's reading instructions plus the VST, which is 92% accuracy. And for the ABLLS, validity is the normative standard, which means that it can be compared to other children in that age range.
So we chose the VB-MAPP ultimately for this client based on an interview conducted with her parents. As Carly mentioned, they provided information about her demographics, current skills, and challenging behaviors. She's 3 years old, which means she falls into the age range scored on the VB-MAPP. And what's helpful about the VB-MAPP is that it compares the individual to where their typically developing peers are at different milestones. As our client enters ABA therapy, she can be assessed and reassessed with the VB-MAPP. This is usually done every 6 months until she acquires the developmentally appropriate skills to fill in different skill areas regardless of her age. Some of the skills assessed in the VB-MAPP are MANS, TACS, echoics, interverbals, listener responding, and play and social skills. With the VB-MAPP, it'll be easy for the BCBA to identify her current skill level in different developmental areas, as well as identify barriers to her learning. This information provides the BCBA with a clear direction in choosing target skills for intervention. For example, if the VB-MAPP assessment conducted on our client shows that she is not able to respond consistently to simple instructions, as was reported in her parent interview, then the BCBA would know that the client needs a receptive one-step instructions program. When it comes time to reassess the client's skills, the BCBA can easily see the progress made as well as skill areas that require more acquisition programming. Thank you for coming.